There were so many decisions made about this building that was so important. The rooms here are so beautiful, all the natural light. And when it was finally opened, it was a really emotional time for a lot of people. A lot of people had put in all the years' work in the lobbying, all those years of just asking the federal government, please give us this cancer centre. And the community responds now in how they support it.
The community certainly got behind Albury Wodonga and tried to lobby very hard to the politicians and to the local members to improve the services, to make sure that we had a service available for patients in one location that was available for everybody at any time. And I think without the community, we would not have the centre we've got today.
We decided that we wanted to do a rally, and did it down on the causeway. One of the community knew someone who had a helicopter, and they offered the use of the helicopter and a photographer. And so on a Sunday morning, we got, I think it was 1,300 people, which represented the number of cancer cases per year in the region. So 1,300 people turned up, put on yellow ponchos representing the daffodil colour, and I think that was a really powerful statement.
We were so excited with the announcement that was made. The vibe around the hospital was so good to see that everyone was so happy that we finally, after years and years of lobbying, had been able to come to fruition with a cancer centre.
Before the cancer centre was built, we had facilities in different places across Albury Wodonga, and so what the cancer centre enabled was bringing it all together under one roof. And we were able to expand services. So as well as bringing the existing services under the one roof, we have things like the wellness centre, radiotherapy services have expanded with different treatment modalities that used to be only available in metropolitan areas.
I'm an 18-year breast cancer survivor myself, and unfortunately I've lost my dad to cancer and my son to cancer. My son and we had to leave the rest of the family behind. He was 19 and we had to move to Melbourne for 12 months. It's just an enormous financial and personal and emotional challenge on a family. He passed away in 2014. And then I got to be involved in the trust fund, got to watch the cancer centre be built. And I guess it became my passion, my personal passion, that people in rural areas should have the exact same outcomes as our metropolitan cancer patients.
I think it really has proven its worth because we've got data showing that we've bridged some of that gap between metro and regional. This region used to have one of the worst cancer outcomes in the state. And so now we have the best outcomes compared to other regions in Victoria. And I'm sure the Cancer Centre and bringing service together really helped in that process.
So in the last 5 years, the community has helped us raise enormous amounts of money, and it means that $2.5 million have been spent in the Cancer Centre. Sometimes it can be a large thing, like literally a large piece of equipment that can cost, say, $300,000. Our latest piece of equipment is breast reconstruction surgery equipment. We fully fundraise the Wellness Centre up to $300,000 a year. What helps us make a decision is how is this going to impact people and stop them going to Melbourne. Once they show us a piece of equipment and say this will stop people going to Melbourne, we bought a scope a couple of years ago that stopped people going to Melbourne just to get diagnosed for lung cancer and GI cancers. So sometimes it's at the start of the cancer journey, sometimes it's to help people at the end of their cancer journey. Our community continue to support us. We feel that we don't even have to try that hard. I think it's just that connection that people have to the Cancer Centre and that ownership. This community, this local Albury Wodonga, complete regional community, there's just no end to their supportiveness and how far they're prepared to go.